Welcome to the Mobile Health Without Borders course. My name is Bertalan Meskó. I'm a medical futurist. It means as a geek doctor, my job is to fill the gap between empowered patients and their not that technology savvy doctors, as well as between digital technologies and everyday medicine. I'm quite an active social media user. I manage to crowdsource a diagnosis on Twitter, and I've been creating networks so then they can filter the news for me. Just like how I filter the news for them by sharing those articles every single day I find interesting and useful. Mobile health is a term used for the practice of medicine supported by mobile devices. But it doesn't have to start with smartphones and tablets. One simple text message can even improve care. In the country of Kenya, patients can send text messages including the serial number of the drugs they just purchased, and they will get a prompt response whether the drug is fake or real. I believe in social media and mobile health, curation is the key. We need to curate medical resources and mobile applications, both for patients and medical professionals, for free. And that's what we have been doing on webissim.com, where we do this with professionals and e-patients worldwide by manually selecting, curating the world's best social media resources and mobile applications focusing on medical conditions and medical specialties in over 100 topics and 20 languages. The only way to fill healthcare with medical professionals who are proficient at using technologies is to train them like that. That's why I've been teaching medical students about the basics of internet, using social media platforms and even mobile health solutions. At this course at Semmelweis University, I help students learn how to assess the quality of a medical website or how to choose the right medical smartphone application for themselves or for their own patients. As plenty of medical students and physicians wanted to access the course from around the world, I thought there should be an online version, the social media course, a free course for everyone containing 16 extended presentations, handouts and tests. And all the students, right now, over 1,500 of them, are working hard to get the final badge, the ultimate expert badge, and to get a certification. I think that's the only way to prepare medical students for a world they will have to face by the time they graduate from medical school. We have to make them ready for a digital world, and they have to make them be able to deal with e-patients. I've been a huge fan of the quantified self movement, as for the last 15 years I've been logging my sleep patterns, physical activities, scores of my mental and physical well-being every single day. I believe in the near future patients will be able to measure anything about themselves, from clinical parameters, blood counts and blood glucose content, to ECG and even genomic data. And they will bring that kind of data to their medical professionals by using mobile technologies, smartphones, tablets and other gadgets. I have my own Alive Core device which lets me do an ECG by using an iPhone. I can do a single channel or a chest channel ECG. I also have my Fitbit. I have all these gadgets that let me measure my own health parameters myself. In the future of medicine, we will see more and more applications related to augmented reality. I'll give you two examples. The first is about public health. In the Netherlands, public authorities published the GPS locations of semi-automatic defibrillators. So when there is an emergency situation, people can grab their smartphones and looking through the camera, the smartphone will let them know in which direction, in how many meters they can find a defibrillator. The second example is about the real future. An Italian group managed to create an application, so when I look through the camera of my smartphone and I see the patient's leg, it can merge the data of the patient's radiology images, CT, X-ray or MR, and then I can zoom in or zoom out the patient. Literally, before an operation, I can look into the patient. That's just one amazing feature of the many examples we see right now. In order to include digital technologies in everyday medicine, there are some things that we can do. First, we have to train medical students about using these. We have to prepare medical professionals about using these in practice right now. We have to curate medical smartphone applications for patients for free. And moreover, I just wrote a book about the clinical use of social media, a real handbook containing step-by-step instructions and guides without concepts and essays. I think we need to use mobile health solutions in medicine, but for this we have to help all the stakeholders to get to a real meaningful use, because the opportunities of using mobile health in medicine has not yet been fully explored.